Hi, I am Dr. Siva Prasad, consultant pediatrician and neonatologist working at Cloudnine, Thanisandra, Bangalore. Squint in children. So one of the most commonly heard problems from the parents in an OPD practice. So squint or strabismus is nothing but commonly called as misaligned eyes or malaligned eyes or cross eyes. So squint in children, it has a lot of reasons for it. It has to be evaluated properly. So for example, when the child is born, and the newborn most of the times might have a mild deviation of the eyes, which until 3 months of age might get corrected on its own. So any child who is more than 3 months of age and you see a proper malalignment of eyes and the deviation of the eyes, always take an opinion of the pediatric ophthalmologist to evaluate whether the child is having a proper squint. So squint is nothing but when you are looking at a particular object, both of your eyes should be aligned in a single direction. So if one eye is deviating either to either of the sides, then that is called as a squint. First thing what you have to confirm in your child, so whether the child is having squint constantly or whether you are noticing the deviation of eyes only on particular situation. For example, child is watching close object, or when the child is watching a mobile or anything, or it is constant irrespective of what the child is doing. When the squint is constant irrespective of what the child is doing, it's always a matter of concern. You have to get evaluated the child by a pediatric ophthalmologist and see what is the cause of it, what is the degree of squint, what is the type of squint, because squint is not a single type. It can be like inward deviation of the eyes, outward deviation of the eyes. When the child is untreated with the squint, the main problem will be with the vision of the eyes. So when one eye is looking other direction from the other eye, so the brain always has a possibility to shut down the vision of the eye which is deviating. So that is one of the problems. Other problem is malalignment. So that is called as amblyopia. So then when the child vision is not corrected when they have squint, the child always have a problem of depth perception. So that is one of the common reasons. That's why after the 3 months of age, always when you see the child eyes are deviated, take the opinion, get the treatment if necessary. So if the squint is very severe, there are certain surgeries to correct the squint also. So it depends on the type of squint. So what type of treatment has to be decided by the ophthalmologist.